Hi and welcome to Wellness Wednesdays. I'm Dr. Threadgold, one of the owners of Halo Physio. This week is another controversial take. Does your MRI scan actually matter? Now, this might be slightly counterintuitive to some of you, but before I was a GP, I was actually a surgeon. And during my surgical training, I was being taught by one of the old guys, one of the old-fashioned people. And one of the things that he always used to say to me is, if it quacks like a duck and waddles like a duck, do you need a picture to tell you it's a duck? And the reason being that a lot of the diagnosis is in the history that people tell us. So take back pain for an example. Most back pain, there's a history which will tell you why that back pain has happened and what you can do about it. Do you need a scan to tell you that that is the case? Now, most patients think that you do. Actually, 90% of the time, back pain scans are absolutely irrelevant. You might get a report from your scan which has words in it like disc degeneration or disc bulges, words that strike the fear into men and women across the land. But actually what they don't tell you is that depending on your age, say you're 50 years old and you've had a scan, 50% of the population have got disc degeneration or disc prolapses, but they cause no symptoms. So actually, what really matters much more than your scan is the symptoms that you have and the story that you tell your clinician about how the symptoms started. And it is with that, plus a clinical examination, that we can then come up with a management plan to get you better again. You really don't need a picture to tell you what we can tell from the story and a good clinical examination. Don't get me wrong, in some instances, scans are helpful, usually if things aren't getting better when we expect them to. And in America, where things are very motivated by finance, they incentivize clinicians to send them for scans because they get paid for doing so. In the NHS, it's the opposite. Clinicians get told not to send people for scans because the NHS is always strapped for cash. So scans do have their place. It's somewhere in the middle of always being needed and never being needed. And ideally, it should be on a case-by-case basis. So if you're in any way concerned about this niggling injury or thing that's affecting your mobility, then by all means, come down and see one of our clinicians and we'll be soon to put you right and tell you if you need a scan or not.
Call the one you know, Halo Physio.